G'day guys, and today I think it's about time we had a chat about coronavirus, especially since, as of today, the World Health Organization has come out and declared it a global health emergency. Now, they've declared that this is an emergency based not on the fact of the countries where it's infected, but on the fact that it could spread to countries with poor medical apparatus. I'm thinking of countries such as India, certainly Bangladesh, with a very high density population crushed into a very small area. We could see this virus spreading to places with poor medical infrastructure and absolutely just running riot. Now, I think we can all imagine just how much of a catastrophe that would be for those nations, but I think it's appropriate that I, as an Australian, discuss mostly Australia in this video. So Australia, as of now, the 31st of January, has 9 confirmed cases of coronavirus. Obviously, we have people flying in from China, and the Chinese appears to have done a very poor job of containing the disease. After they knew about the outbreak, there were 5 days in which 5 million people or some crazy number were able to leave the Wuhan region and move all over the country. It took them days to lock down the airport, so obviously they can't keep this under wraps, and even though they've attempted to quarantine that region quite heavily, 35 million people under quarantine, it's still spread around to other provinces in Shanghai and Beijing and that sort of thing, so they obviously can't keep the genie in the bottle, which is why we're seeing cases popping all over the world thanks to global travel. So 9 cases in Australia in 3 different cities. 2 have been declared recovered and have been discharged from hospital. But again, we have 7 confirmed cases. But the thing you have to worry about, and this is what I keep reminding people when this is coming up in real life conversations, it's not these 7 people or these 9 people we've got to worry about. It's the dozens of other people they potentially could have infected, or potentially even hundreds, like an exponential. Because what you need to understand about coronavirus is that you can spread it when you are asymptomatic. So you can have no symptoms at all, you don't even know you're infected, but you can run around spreading it to other people, as we've seen in Germany. Because what occurred in Germany is a man had a meeting with someone from China, and the man from China was completely asymptomatic. He didn't know he had coronavirus. Even just through that sort of level of contact, you have someone in a business meeting, presumably just a handshake and then sharing the same room together. He managed to spread coronavirus to that German man, who then went and spread it to, I believe, 3 others. And again, that's without anyone knowing they had the disease whatsoever. Everything's totally hunky-dory and normal, and we're still getting these infections. So yes, that's something that's incredibly important to remember, is that coronavirus can be spread asymptomatically. And this asymptomatic period can last up to 2 weeks. So what we have to do is, when we grab someone who is showing symptoms of coronavirus, when we take them to the hospital, we really need to ask the questions: what have these 2 people been doing for the last 2 weeks? Who have they come into contact with? And this sort of thing. And this is a big problem when we have these people coming to Australia from China, because obviously they've been inside an aeroplane, which is, crushing people together like sardines. Hundreds of people on an aeroplane in close proximity, I should say. Then we get to the airport. Again, lots of people moving around, potentially taking public transport from the airport to their place. Certainly their family members or flatmates that they're staying with certainly would be under investigation for suspected coronavirus. I believe there are dozens of Australians in these locations under observation for suspected coronavirus. But again, it wouldn't be just dozens of people who potentially could have caught this disease. It could be hundreds, because we're talking about high density population areas like airports and trains and public transport and this sort of stuff. And again, we've had 2 weeks for these people to move around and potentially get into contact with people. You can get into contact with a lot of people in 2 weeks, even completely accidentally, just through your daily commute and that sort of thing. So that's the thing that really does spook me out about coronavirus. And again, not many people, at least in my circle, seem to be taking it seriously. It's the fact that this virus can spread when you're asymptomatic, and this virus can be asymptomatic for up to 2 weeks. And again, even when you start showing symptoms, it just keeps getting worse and worse. The symptoms are very much like the common cold. So you may be infected with coronavirus, you get a bit snuffly and this sort of thing, you're sneezing, you're coughing, you don't think much of it, you've just got a cold, you'll go to work, you'll travel around, you'll go to uni, and you'll infect more people. So I would expect the number of cases in Australia, as we move into these next couple of weeks, to continue to rise. I don't think this has been kept under wraps at all. I will expect the potential number of cases in Australia to increase by many dozens, because again, these people could have come into contact with hundreds of potential people to infect. So some other breaking news today concerning coronavirus in Australia. What the Australian government plans to do is it wants to evacuate people who have coronavirus to Christmas Island. Now, you may have heard of Christmas Island being the offshore detention centre for refugees in Australia. So obviously when illegal immigrants attempt to arrive in Australia, they are stopped, turned around, and sent to Christmas Island for basically indefinite incarceration. Now, Christmas Island has been closed. There's only one family of people at the moment, a Sri Lankan family awaiting or fighting a deportation case. But the plan is that we can move all these people out to this offshore place. It's like 1,000 kilometers offshore, isolate them, treat them, and monitor them there. Now, this is a smart decision, I think, because obviously when we have people infected, you don't want them coming into contact with any new people to infect. So yeah, move them away and isolate them, and you can better treat them that way and eventually curtail the spread of the disease. I think that's a good idea, but again, as we've explained previously in this video, just taking the people who are infected and moving them offshore doesn't work. It's not going to halt the spread of the virus. It could slow it down because, you know, the people obviously infected can't get into contact with other people. But again, as we've explained previously, they've already had 2 weeks to asymptomatically infect people, and you know, we're not picking up those people. We're not going to do what the Chinese government is apparently doing, according to some videos, which is arresting people on the street who show signs of coughing and sneezing and that sort of thing. The Australian government presumably won't do that at this point in time. I think it's a good gesture to do this sort of thing, and you know, it's being criticised, you know, death by association and that sort of thing. But again, the media and the establishment isn't really taking this disease too seriously, and I think they should be. I know I am certainly taking this disease seriously. I want to get in ahead. I would rather be, you know, a day early than a minute late, so to speak, in my preparation. So I've already gone out and begun to build up supplies, because what the I believe it was the Australian medical apparatus, what they've recommended is, if you've come into contact with someone who's a confirmed case of coronavirus, what you should do is isolate yourself in your home for 2 weeks, because obviously you can wait for the symptoms to appear and not run around infecting other people. So what everyone should have, and what I encourage all my followers, anyone watching this video, to do, is build up 2 weeks of supplies in their home. Now, I'm not an expert in this sort of thing. I'm no, you know, hardcore prepper or doomsday sage or anything like that. So I'm not going to give out too much advice here, because again, I'd rather you go to a more authoritative source. There's plenty of material on the internet. So I was reading that sort of thing yesterday, and I've begun to stock up. I've grabbed myself a milk crate full of food. I need to grab some water. I would also like some way to purify water. You know, just, you know, whilst I'm here, I may as well get a full prep kit going. Not just for coronavirus, but in case of any kind of natural disaster. Obviously, these bushfires, you're not really camping in your house if a bushfire is going to sweep through your area. But say, for example, flash floods, tornadoes, even if you just lose power for a couple of weeks, there's a lot of things that can go wrong in the world. And I think if you fail to prepare for that sort of thing, then you're putting yourself in a lot of strife later on. So yes, I'm not expecting coronavirus to have a massive outbreak in my area, but I'm just putting myself in that one step ahead position. I want to be prepared. If there is a case near where I live, and down where I live, I should say, I don't want to be, you know, in that mad scrum to grab all the food and stuff at the shops. You know, that could potentially be a dangerous situation. It's the panic. Once the panic sets in, that could be a source of greater misery and violence than the disease itself. So yeah, I want to be ahead of that, be fully prepared, and you know, worst comes to worst in terms of spending all this money, and the disease totally blows over. We get a hold of it really quickly, and nothing ever happens. Well, nothing of value is really lost, because I can just eat all my food. I can drink all that water. I can put it in the garden. Any medical stuff I can buy, that's useful to have to hand anyway. You know, I think I should have a first aid kit to hand, a life straw, and this sort of thing. So nothing of value will really be lost. It's a zero-sum game, and it doesn't hurt to be prepared. I would advise you all to do the same. Look up, there's plenty of good information on prepping on the internet. And yeah, but this coronavirus is certainly no joke. I've included some links down in the description to the semi-live update trackers. You know, it's not doing it second by second, but as new information comes through, it updates it. And unfortunately, what I'm looking at in one of these things is the total number of deaths is higher than the number of people who are recovering. And this is a big problem, because what I'm hearing with coronavirus is that a lot of people need some sort of intensive care to survive this disease. And that's doable. You can give lots of people intensive care when you have a low number of cases. But as I suspect the number of cases will dramatically increase, it seems to be doubling every 30 hours and spreading to a couple new countries every day. There's going to be a lot more people affected. You won't be able to give everyone intensive care, and that's where we're going to see that death rate increase. So again, I encourage all my followers to be prepared. Be able to live in your house, isolate yourself for 2 weeks if need be. Get in before the potential panic sets in. You know, just put yourself that minute ahead rather than being a day late. I will be keeping a close eye on this virus, and I'll keep you all updated with any relevant information. So yeah, thanks all for sticking around. and have a good one.